It started like any other afternoon. You got up from your recliner, maybe to grab a glass of water or head to the kitchen. But as you tried to stand, your right leg didn't respond. You felt off. Your hand was tingling. You tried to speak, maybe to call out for help, but the words came out garbled, like your tongue wasn't listening. You sat back down, telling yourself, "It's probably just my age. Maybe I slept on it wrong." After all, balance isn't what it used to be. Things feel heavier, slower, stranger, right? But what if it wasn't just age? What if that moment was your brain's cry for help? Every 40 seconds, someone in the United States has a stroke. But what most people don't realize is that thousands of Americans experience a mini-stroke every single day. And most of them don't even know it. A mini-stroke, or TIA, Transient Ischemic Attack, might not leave lasting damage right away. But it's often the body's first and only warning before a major stroke hits. And here's the scary part. For many people, the warning signs are so subtle, so easy to explain away, that they get ignored until it's too late. Today, we're going to change that. This isn't about fear, it's about awareness. It's about knowing the signals your body sends when something isn't right. And most importantly, it's about protecting yourself and the people you love. So if you've ever thought, that was probably nothing, this video is for you. Let's talk about the 15 proven signs of mini-stroke, starting with the ones no one expects. So, why is this conversation so urgent? Because a mini-stroke isn't a fluke, it's a red flag. It's your body's way of saying something is wrong with your blood flow. And if you ignore that message, the next time, it might not be so mini. The truth is, 1 out of 3 people who have a mini-stroke will suffer a full-blown stroke within the next year. But here's the good news. If you catch it early, that doesn't have to happen. Awareness can literally save your life. This video is your guide, your toolkit. It breaks down the 15 warning signs that doctors and neurologists say you should never ignore. Some are obvious, others surprisingly subtle. Instead of brushing off confusion as just getting older, you'll learn how to spot the difference. Instead of assuming your slurred speech is from being tired, you'll understand what's truly going on underneath. Because recognizing these signs early doesn't just help you. It protects your spouse, your friends, your family, and possibly your future. So let's keep going. Let's begin with the symptoms you can actually see. They're the ones others might notice before you do. And often, they're the very signs that get mistaken for something far less serious. But make no mistake, these are red alerts. The first is facial drooping. You look in the mirror and notice one side of your mouth isn't moving like the other. Maybe your smile looks crooked, or your eyelid is drooping. It's subtle, but it's there. A viewer once commented, "I thought it was just Bell's palsy." And that's common. People assume it's temporary nerve irritation. But if it comes on suddenly, without any clear reason, you should not wait it out. A stroke or a mini-stroke can do the same thing. The difference? Bell's palsy affects the nerve. A stroke affects the brain. And your brain doesn't give second chances so easily. Next, slurred or garbled speech. You know what you want to say. You can think it clearly in your head. But the words come out twisted, slow, or sound like you've had a drink when you haven't touched a thing. Sometimes you might not even hear the difference, but your spouse, your friend, or even someone on the phone may say, "You don't sound right." That's not being tired. That's not just forgetting a word. That's your brain misfiring, and it needs attention fast. The third sign? Loss of balance or coordination. You're walking across the living room, and suddenly you stumble. Not because of a rug or poor lighting, but because your body feels like it's leaning to one side, or your foot doesn't lift the way it should. One viewer in their 70s said, "I thought my balance issues were just aging, but this video made me realize it could have been something more." That realization, that's everything. Because instead of waiting and seeing, they got checked. They acted. And they may have saved themselves from what could have come next. And then there's visual changes. Blurred vision, double vision, a sudden curtain of darkness over one eye. It's easy to assume it's dry eyes or just needing new glasses. But vision loss, especially when it happens out of nowhere, is one of the most overlooked signs of a mini-stroke. And these symptoms? They're often dismissed. We don't want to feel dramatic. We don't want to bother anyone. But here's the truth. Every second counts. These visible signs are the brain's way of waving a flag. Don't ignore that signal, because catching it now means preventing something far worse later. So next time your face feels off, your words don't come out right, or the room tilts without reason, pause, breathe, and act fast. Now let's move on to the symptoms that you might feel, but others can't see. These are often the trickiest because they can seem mild or come and go in seconds. But don't let that fool you. What you feel inside matters just as much as what others notice on the outside. Let's start with numbness or tingling. That pins and needles feeling in your arm, hand, or leg, especially on one side of the body. You might chalk it up to sleeping in the wrong position or sitting too long. But here's the difference. Stroke-related tingling doesn't go away when you shift or move. It appears suddenly, without reason. And sometimes, it's not just numbness. It's a strange heaviness, like your limb just won't cooperate. Can that happen with aging? Sure. But aging doesn't strike in seconds. A mini-stroke does. Next, sudden fatigue. Not just, "I had a long day, tired." This is more like your body flipping a switch. One moment, you're fine. The next, you feel like you've been hit with a wall of exhaustion. Even lifting your arms or walking across a room feels overwhelming. One viewer said, "I could barely keep my eyes open. It felt like my body had shut down." That's not normal, and it's not something you should push through. It's a sign to slow down and speak up. Then there's dizziness or vertigo. We all get a little woozy now and then, maybe from standing too fast or not drinking enough water. But stroke-related dizziness hits differently. The room might spin. Your body might feel like it's moving when it's not. Some people even feel like they're tipping over while sitting completely still. And when it comes out of nowhere, combined with other symptoms, it's not dehydration. It's danger. Another one? Memory issues or confusion. You might forget where you are, or what you were about to say. Maybe you start a task, then suddenly stop because you forgot what you were doing. One viewer described it perfectly. "I lost track of time, forgot how I got where I was. I knew something wasn't right." And that's the key. When your instincts say something feels off, listen. Because your brain might be trying to tell you something important. These invisible symptoms are just as critical as the physical ones. And because they're easier to dismiss, they're often more dangerous. So instead of brushing them off, compare them. Ask yourself, is this something I've felt before? Or is this new, sudden, unexplained? If the answer leans toward new and strange, don't wait. When your body whispers, don't wait for it to scream. What about changes you can't see or touch, but you can definitely feel? Sometimes a mini stroke doesn't hit your body. It hits your personality, your mood, your sense of who you are. And that makes it even harder to recognize, especially if it comes on slowly or happens when no one else is around. Let's talk about sudden mood swings. Have you ever felt completely fine one minute, then angry or tearful the next? Maybe you laughed at something that wasn't funny, or snapped at someone for no reason. One woman wrote, "I didn't feel like myself that day. I cried in the middle of folding laundry. It wasn't me." That kind of emotional swing out of the blue isn't just about stress. It could be a sign that blood flow to parts of your brain, especially the frontal lobe, which regulates emotions, is being interrupted. Another symptom? Apathy. You lose interest in things you normally love. You sit through your favorite show and feel nothing. You stop talking to loved ones, not because you're upset, but because you feel blank. It's easy to dismiss this as depression. And yes, depression is real. But when this flat feeling appears suddenly, without a history of mood issues, it may be more than emotional. It may be neurological. What about inappropriate behavior? Saying things that don't fit the moment. Making poor decisions that don't reflect your usual judgment. One viewer shared that their spouse began acting oddly days before their stroke, joking in serious moments, walking out of conversations, ignoring social cues. They thought it was stress until the hospital confirmed a TIA had occurred. Instead of asking, "What's wrong with me emotionally?" we should also ask, "Is something happening in my brain?" Because when personality changes appear out of nowhere, they're not just emotional, they're biological. And that's the point here. Whether it's irritability, sadness, silence, or confusion, when the change is sudden and unexplainable, don't ignore it. Your mood is part of your health, and your brain may be sending a signal that it needs help. Let's talk about what all this really means. A mini-stroke is not a one-time event that comes and goes without consequence. It's not something to sleep off or wait and see. It's a message, a bold, flashing warning sign that says, if you don't act now, something worse could be coming. How bad? Research shows that after a mini-stroke, what doctors call a TIA, your risk of a major stroke skyrockets. One study found that 8% of people who have a mini-stroke will have a full stroke within just 7 days. That number jumps to 17% within 3 months. Think about that. Instead of having weeks or months to prepare, you may have hours. Instead of being fine next week, you could be in the ER tomorrow. And most frightening of all? Many people don't even know they had a mini-stroke until the real one hits. But here's the hope. When recognized early and treated quickly, your outcome can be dramatically different. Another study revealed that with fast medical intervention, the risk of stroke after a TIA can drop from 17% to just 1%. That's a 94% difference. So why does this matter? Because the faster you move, the more you protect. Your brain, your speech, your mobility, your independence. Every second of delay risks more damage. And it's not just the stroke you need to worry about. Studies also show that people who've had mini-strokes are more likely to suffer long-term memory issues, cognitive decline, and chronic fatigue. even if the stroke never returns. One viewer shared, "I was tired for months, couldn't think straight. Everyone thought I was fine because I could walk. But I wasn't fine inside." So let's say it clearly. A mini-stroke is not minor. It's urgent. It's the beginning of a clock ticking. And the choices you make in that moment, whether you act or not, can shape your future. Your brain is giving you a chance. Don't miss it. Now that you know what to look for, how do you act fast? There's an easy way to remember the signs of a stroke or a mini-stroke and what to do next. It's called the FAST test. F stands for face. Ask the person to smile. Does one side of their face droop? A is for arms. Ask them to raise both arms. Does one drift downward or feel weak? S is for speech. Can they repeat a simple sentence? Is their speech slurred or strange? T is for time. If you see any of these signs, don't wait. Call emergency services immediately. But here's something new. One viewer came up with a second acronym, SLOW, to help others catch more subtle signs. S for speech problems, L for leg or foot numbness, O for orientation, feeling disoriented or confused, W for wait and call for help. Don't try to push through, because sometimes the signs aren't obvious. You may not see facial drooping, you may not slur, but inside, your brain is struggling. And that means every second matters just as much. So whether you remember fast or slow, the point is to notice, to trust your instincts, and to act sooner, not later. Instead of hoping it goes away, treat it like the emergency it is. Because with strokes and mini-strokes, time doesn't just matter. Time is brain. You've made it this far. And maybe, just maybe, something you heard today felt a little too familiar. Maybe it reminded you of a moment you brushed off, a strange feeling in your leg, a word that wouldn't come out right, a sudden fog that passed before you could explain it. Instead of ignoring those moments in the future, now you know what to look for. Now you understand what they could mean. You're not guessing anymore. You're prepared. Because a mini-stroke isn't just a warning. It's a chance. A second chance before something bigger, harsher, more permanent arrives. So take that chance seriously. Use this knowledge. Share it. Talk to your loved ones. Re-watch the signs. Practice the tests. Keep it close. Because the next time something doesn't feel right, you won't hesitate. You won't wonder. You'll know. And that knowing could be the reason you, or someone you love, gets to stay here longer. And that, my friend, is everything. If something in this video made you pause, if it reminded you of your spouse, your neighbor, your best friend, don't keep that to yourself. Share this video with them. You never know what moment might make a difference. You never know what quiet symptom someone else is silently carrying. And maybe, by hearing these signs in your voice, not just mine, they'll finally listen. Leave a comment if you've ever experienced one of these symptoms, or if someone close to you has. Your story could help someone else recognize the warning signs before it's too late. And if you found this helpful, make sure to subscribe. We're building a space here for people who care, people who want to stay informed, people who want to protect their health and the health of those they love. Because instead of feeling afraid, you can feel prepared. Instead of guessing, you can be ready. Let's keep learning together.